Mine, they just, because the right side was shattered, they plated them. But that's basically all they did. Because you can't really do much.
And they can't do, so most of the time when you break a rib, they're just going to let it heal on its own. They can't put a cast on it. They just leave it. Except in really severe cases. So for hers, if you look at her x-rays, some of the ribs on the right side were broken in multiple places. Mm-hmm. And so she had little pieces of bone.
That were floating.
And they weren't lined up. There was no way that was going to heal. And so the only option was to go in and find all those pieces and put them back together and plate them. But that's kind of a severe case. In a traditional broken rib, they would just wait until it heals and give you something for pain because there's nothing that they can do otherwise.
And the body just over time.
Yeah, over time it just heals.
Yeah.
And even if they're not quite lined up correctly, your body will kind of make up the difference and just kind of fill in that space and it'll heal. But for her, it couldn't heal until and her lungs couldn't expand fully with the ribs lying on the lungs.